Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Noor Sulhana binti Dzainal. My metric number is 1172535. Inshallah, for this video, I will present about my research proposal, and the topic is the relationship between religious and depression. Chapter 1 consists of a few subtopics. Let's move to the first subtopic, which is introduction. Basically, my topic is the relationship between religious and depression among Taman Industri Sri Sulong resident. Is thesis by me as a researcher for partial fulfillment for Bachelor of Degree in Counselling with Honors at Universiti Islam Islam Malaysia, Bandar Baru Nidai, Negeri Sembilan in 2020. The purpose of this study was to assess whether there is a relationship between the self-report level of religiosity and the self-report level of depression among Taman Industri Sri Sulong resident in Batu Pahat, Johor. Research background for this research proposal is, recently, work has shown that the relationship between religion and depression may have negative effect or probably have positive result. Prior to this study, it was not known if and to what extent a relationship exists between religious and depression. Let's move to the problem statement. The study population consists of the four different religions involved: Islam, Buddhism, Hinduism, and Christianity from Taman Industri Sri Sulong of resident. People with depression are more likely to generate stressful events, and individuals with a higher genetic loading for affective disorder are more likely to experience depression after a stressful event than those with low genetic loading. Research objectives consist 3 points. The first point is to identify level of religiosity. The second point is to examine level of depression. And the last point is to investigate the relationship between religiosity and depression. Research questions also consist 3 points. The first point is what is the self-report level of religiosity among sampled residents of Taman Industri Sri Sulong. The second point is what is the self-report level of depression among sample participants. And the last research question is how does the level of religiosity that can affect an individual's predisposition to depression. As my hypothesis, there is no significant relationship between religious and depression. Significance of the study consists 3 points. The first point, individuals need to understand depression, its symptoms, possible cause and treatments. This will help to understand your loved one and how he or she is feeling. The second point is how health educators develop depression awareness, and they can teach, care for and offer support to people who are suffering depression. The last significance of the study is useful to psychologists, therapists, counselors, religious members like ustaz and the priors, as they can learn and practice, as it may help them develop insight regarding the connection between religiosity and depression and how it may influence their other people. 1.8 Reveal the scope of the study. Malaysian in Taman Industri Sri Sulong resident based on 4 religions which are Islam, Christianity, Buddhism and Hinduism. Basically, the scope of study focus on adult and depression. Definition of terms consists 3 points there. Depression. Depression can be characterized by sadness, loss of interest or pleasure, feelings of guilt, or loss of worth, loss of sleep or appetite, feeling of tiredness and poor concentration. By WHO 2016. Religion is a belief in a high power such as Christ, Allah, and Buddhism. From the Islamic perspective, religion is a broader construct which encompasses a way of life. Religiosity is the strength, participation, and commitment an individual has to religious belief. Conclusion for Chapter 1. Major elements included within Chapter 1 were the background of the study, problem statement, research questions, and research objectives. Significance of the study, scope of the study, and definition of key terms also involved in Chapter 1. Okay, let's move to Chapter 2, Literature Review. Within this chapter, the researcher provides a review of the literature, informing key topics and themes related to the problem statement. Topics and themes include religion, religiosity, depression, cognitive behavioral therapy, and other as long as the researcher can get points from the past study. To have the hardcore proofs, all of the literature reviews will be reviewed according to 10 years back. In this video, I put a few literature review. For the first literature review, Doris White in 2017 published an article about the relationship between religiosity and depression among sampled Kenyans in the Twin Cities metro area. The results show that no significant correlation was found between the self-report level of religiosity and the self-report level of depression among sampled Kenyans. Next article related was religious coping as a moderator of the relationship between stress and depressive symptoms. This topic published on 2016 by Joshua L. Atlas, Amy H. Mazulis, and Melissa R. Hudson. The researcher found no evidence for positive religious coping as a buffer against the effect of stress on depressive symptoms. The third literature review in 2011, Courage Amrai, Hamzeh Azizi Zalani, Faribor Sadiq Arfai, and Mariam Sadat Sharifian had a journal named The Relationship Between the Religious Orientation and Anxiety and Depression of Students. Data analysis showed that the high negative correlation between the religious orientation and anxiety and depression of university students. Fourth, topic religion and depression in adolescents in 2019. Three other authors involved. The result suggests that religiosity decreased depression. It means, in standardized terms, that an improvement in religiosity by 1 standard deviation corresponds to a decrease in the depression score of 0.31 standard deviation. Lastly, religiosity, anxiety, and depression among Israel medical student article help a lot by doing this thesis. This article, released in October 2011 by Maya Krichman, Lupo MD, and Rael D. Strauss MD. As a result, did not show any significant association between religiosity and depression or anxiety. For this topic of my research proposal, the researcher used counseling theory, which is cognitive behavioral theory is a mixture of both cognitive and behavioral therapies, and it's very effective in treating disorder of depression and anxiety. Basically, this therapy has its origin in the work of Aaron T. Beck and Albert Ellis. The number of sessions followed by the client depends on patient responsiveness. Basically, CBT approaches focus on correcting negative biases in informing processing and avoidance behavior in an effort to reduce symptoms of depression and anxiety. Islamic view consists 3 points that I put inside this video. Surah Al-A'raj, verse 28. Verily, in the remembrance of God do hearts find rest. Second, Surah Ash-Shar, verse 5 to 6. Which is so, verily, with every difficulty there is relief. Verily, with every difficulties there is a relief. And the last one, Surah Al-Imran, verse 160. If God helps you, no one can overcome you. And if he forsake you, who is there after him that can help you? And in God, which is alone, let believers put their trust. Conclusion for second topic consists introduction about purpose of the thesis and related previous literature review 10 years back, and theory that's suitable with this issue, which is CBT. Lastly, there are also a few points of Islamic perspective which prove by Quran and Hadith. Research methodology consists in chapter 3, the introduction. This study assesses whether there is a relationship between self-report level of religiosity and self-report level of depression among sample residents in Taman Industri Sri Sulong. Let's move to the research design. This study used quantitative methodology with a correlation research to examine is there any relationship between exists. As a sampling, the researcher used 100 respondents, which is randomly according to religion, and each religion consists 25 respondents. Data collection consists 4 points, which is ask approval, introduction, introduce the purpose of the survey, and the participant need to complete the set of questionnaire, and the last one, Google form, is used to survey the service and collecting data. As the data analysis, the researcher used correlation and overall data saved in SPSS spreadsheet for analysis. The researcher used %R to measure the linear dependence between two variables. Instrument used, which is questionnaire of religiosity, patient health questionnaire, and demographic. As a pilot test, the researcher do the survey to 8 respondents, and the conclusion for this third chapter, the researcher used quantitative methodology and correlation design. I think that's all for me. Thank you so much. Assalamualaikum.